war on drugs actually turns out to be a war on Hispanic people, a war on people of color, actually a war on us.
No more drug war! No more drug war!
Getting mothers together from across the nation to speak out against the violence, the mass arrest and incarceration, and the accidental overdose deaths that are the result of punitive drug policy.
I can't understand how a drug-oriented society found it necessary to declare war on itself.
The drug war, I want you to understand this right now, is nothing but the mask of all the stuff we hate. The drug war is the mask of racism. The drug war is the mask of sexism. The drug war is the mask of xenophobia. The drug war is the mask of homophobia, Islamophobia. And one of the things that we're going to do is take off the mask.
I think we've hit the tipping point on marijuana because of what Colorado and Washington did and what Uruguay is going to do. We've hit the tipping point because the Justice Department, and thank you to the Obama administration for giving these states a little bit of room to run. We may be at the tipping point on marijuana, but 2 states down and 48 to go, and hopefully 1 country down and 200 to go. That's a long way to go.
Marijuana legalization is just the start. We still have people going to prison every year, 2.3 million people incarcerated in this country, and we have to change that. You know, the movement will continue to go forward because we have minds like this coming together and talking strategy, talking about what's working, what's not working.
This is a long-term struggle for freedom. For freedom and liberty. Yes, and compassion and justice and health and science, but it is for freedom and for liberty.
I'm an abolitionist. I fight for the abolition of the newest iteration of slavery in this country, mass incarceration. I'm actually quite new to drug policy, less than 3 years. I spent over a decade working in criminal justice reform without realizing the absolute impact of our drug laws on social justice and racial justice and criminal justice in this country. I worked in policing reform and gang intervention and juvenile detention systems, and it felt like Groundhog Day, or like sticking my finger in a fire hose, but a fire hose of people, of young black and brown men, flowing into incarceration and lifetime of barriers to becoming a successful citizen. It was Michelle Alexander's book, The New Jim Crow, in 2011, that turned things straight for me. In that seminal book, hopefully you've read it, but in that seminal book, she meticulously details how mass incarceration is just a rerun of previous systems of legal and structural racism we've had in this country, slavery and the Jim Crow laws. And under all 3 systems, black people, and sometimes others, are denied voting rights, property rights, business licenses, public benefits, educational loans, and sometimes basic employment. And this is why we end up with prisons and jails that are overflowing and full of people of color. Michelle Alexander goes on to track how in this 3rd system of mass incarceration, the major driver, the major weapon has been the war on drugs. When you criminalize behavior, drug taking, that people of all races and nations have been partaking in for thousands of years, and then selectively target minorities for enforcement, this is what you end up with. So, I'm a frontline fighter, I'm a warrior for justice. When I see an opportunity to make an impact, I take it. And the Drug Policy Alliance is the nation's leading organization fighting to end the war on drugs. We are trying to stop that fire hose. We are trying to undo and end those repressive drug laws one by one all across the country. And in California, there's some good things going on here. This has been a great year for DPA in California, seminal year. We won all 3 of our bills. The governor signed them into law. We eliminated the disparity between crack and powder cocaine under California law. We've made sterile syringes accessible in pharmacies in every county in California. And we made naloxone, which is a silver bullet to overdose. It is the opiate overdose reversal drug available for the first time behind the counter in select pharmacies across the state. And we don't always win in California, so this was a great year. And these laws, they save lives. They prevent Hep C and HIV infection. And they codify that the same crime gets the same time. And yet, California, as you've heard, is still the country's largest incarceration system. 216,000 people at my last count. And LA County makes up a third of that, and then also has the largest jail system. So with your assistance, I'm hoping to tackle 3 key criminal justice reforms in the coming year, all that fall under the sentencing reform umbrella. First, as part of our statewide agenda, we're going to sponsor legislation that will provide the opportunity for pre-plea diversion for drug offenders. And here's why. Under federal law, all drug law violations are deportable offenses. So whether California treats it as a felony or misdemeanor or infraction, all immigrants are still eligible for deportation. And they are being deported since 2008. Over 250,000 immigrants have been deported for nonviolent drug offenses. So we're working with some of the leading immigrant rights organizations in California to co-sponsor this legislation, and they are very new to drug policy. And this is the culmination of over 2 years of education, outreach, and organizing in Southern California's Latino communities to bring them to the table. And we are looking to have a big impact. Secondly, targeting LA County, we are looking at 2 things to reduce incarceration levels in LA County jails. First, we want to pilot the LEAD program, Law Enforcement Assisted Diversion. This is a pre-booking diversion program. I know I'm saying diversion a lot, but we are trying to get out of the criminal justice system and not go there to begin with. And so LEAD, the first LEAD program was in Seattle in 2011. It's been tremendously successful. It's a simple but powerful model. Officers, instead of arresting a low-level drug offender, they bring them to a service center where they can get acute care, referrals for services, case management, etc. The second LEAD program was piloted this year by DPA in Santa Fe, New Mexico, going very well. I want LA County to have the 3rd program in the country. LEAD has demonstrated that we do not have to undermine basic human rights in order to protect our public safety and our public health. It shows that we don't have to go through the criminal justice system to connect people to the services that they need. The second effort in LA County to bring down the incarceration levels is called split sentencing. Split sentencing was a tool under the Realignment Act of 2011 that you heard about. And basically it means a nonviolent, non-serious offender can serve part of their time in custody and part of their time under community supervision with funded services, housing, drug treatment, etc. LA County opted not to use this for the last 3 years. Instead, we filled our jails up to the breaking point. So through collective advocacy of the reform movement, split sentencing will now be presumptive as of January 1st, meaning required. But in LA County, just because a law is on the books, a county that's that large and poorly mismanaged doesn't always happen. And remember, LA County is larger than 40 US states with 10 million people. So DPA is convening a work group of the key stakeholders, liaisoning with the agencies, analyzing the policy, ensuring that there's robust reentry services funded, and essentially ensuring that people get split sentencing in LA County. It's our aim that up to 5,000 people get a split sentence and expedited release from jail in LA County. Thank you for your time.
Thank you so much, Lynn. One question around this particular award and the project that you've proposed. How will it make a difference in terms of your team structure or, actually how you're going to do the work that you just outlined over the next year?
So the LA County work probably won't happen without funding support. So if it, we've gone elsewhere as well. I am the entire LA County team and can only be in so many places at a time. So it would involve us bringing on some folks on sort of a contract level from LA to do the work.
Okay, so the funding would go to staffing positions, is that
Yes,
essentially what it would,
yes.
would be?
And for the statewide work, there'll be some media, bilingual media market work.
And if, I'm sorry to sound like a broken record, but how will you sustain this program once the funding stream finishes? So what's your plan for sustainability?
Well, in the LEAD program, the law enforcement assisted diversion, what we've done in the other cities we've piloted this in is we've demonstrated through foundation funding that this is a successful model, and then we get the city to do a cost benefit analysis, or we do it for them, and then they actually invest in it. So in Santa Fe, the city council pays for the LEAD program, and we would hope to get there, and we're working with LA City Council members on that now. And for split sentencing, hopefully you won't always need a work group to make it work. Hopefully, after a year, we will have, the systems will be in place, the people will be communicating, the records will be shared, et cetera, so that we can actually make those splits really happen.